Hello, my name is CJ Alexander, and I will be covering over yellow fever disease. As you may notice that this is my second presentation for the disease report. But this time is for different virus. So what is yellow fever disease? Yellow fever is a arbovirus that is transmitted through mosquitoes. And arbovirus is a group of diseases or group of viruses that is spread to people by the bite of infected arthropods, mosquitoes in this case. So symptoms would normally range from mild like flu symptoms such as like fever, chills, loss of appetite, nausea, muscle aches, but it could range to more dangerous symptoms such as organ failure or jaundice, which is where the yellow fever got its name from, as jaundice would cause the yellowing of the skin and the eyes, hence yellow fever. And it belongs to the Flavividae family, to where, as I can see up in the top left, you can see the kind of like the taxonomy of where it belongs to where the species name is the yellow fever virus, and the genus is the Flavivirus. So individual infected with yellow fever will normally feel no symptoms or will feel mild symptoms for 3 to 6 days until they completely recover. So these mild symptoms would include a sudden onset of fever, chills, headaches, back pain, general body aches, nausea, vomiting, and fatigue. So basically the symptoms you normally feel with when you get a cold or flu, and you would generally improve within 1 week of getting these symptoms. Although for some people, there might be an off chance that they might feel weak and fatigue that might last for several months, but normally you will be generally like a-okay. But for some people who don't recover from the mild symptoms, they might go into the severe stage of yellow fever, which is the more concerning part that we need to address. So for 1 out of 7 people who have the mild symptoms, there will be a brief remission period to where they will feel better, but then they will suddenly feel the more severe symptoms of the disease, such as a high fever, jaundice, which is the yellowing of the skin and the eyes due to the buildup of bilirubin in the bloodstreams, organ failure, specifically the liver, as that is failing to break down the blood, which results in bilirubin within the bloodstream, which results in the jaundice, as well as bleeding in the gastrointestinal tract. So among those who would develop the severe disease, 30 to 60% of them would die. So this is like generally very important to look out for. And once you have been infected, you would likely be protected from future infections. So with these symptoms, it is very important to vaccinate or prevent yourself from being bitten by a mosquito to begin with. There are 3 transmission cycles for the yellow fever virus to utilize in order to spread the infection. So the 3 cycles would be the sulfatic, the intermediate, also known as the Sulfana cycle, as well as the Alpin cycle. So the sulfatic cycle will normally take place in a wild/jungle environment where the mosquitoes of the Aeroides and the homogeneous species would infect a non-human primate, such as a monkey or other mosquitoes, and humans could get infected with the sulfatic cycle if a person were to ever go into a jungle and get bitten by an infected mosquito. So the intermediate/the Sulfana cycle is like an in-between between the sulfatic and the urban cycle, to where there are semi-domestic mosquitoes, such as the Aeroides africanus can infect humans as well as non-human primates. So this is where multiple outbreaks can occur. And last, we have the urban cycle, to where in the urban setting, the Aedes aegypti mosquitoes can transmit the virus to humans, and this is where the large epidemics could occur that we would normally associate with the yellow fever virus outbreak. The structure of the yellow fever virus is that it is a enveloped single-stranded RNA in a positive sense that has a shape of a icosahedral that envelops a outer envelope obtained from the host cell membrane with a structural protein such as a capsid in the envelope with viral proteins that are essential for attaching themselves to host cells. Yellow fever is difficult to diagnose due to the lack of hallmark symptoms, as even though jaundice is the reason to why yellow fever is named yellow fever, jaundice could be confused as a symptom for other diseases, as well, in addition to the gastrointestinal tract bleeding. But especially during the early stages of yellow fever, with the cold-like symptoms, for it to be confused with a cold or for it to be confused with a flu. So, and more severe cases can be confused with severe malaria, leptospirosis, viral hepatitis, and infection with other flaviviruses such as dengue, hemorrhagic fever, and poisoning. So some ways of how you can test for yellow fever is the polymerase chain reaction testing in the blood or urine, and it could be detected, the virus could be detected in the early stages of disease, and in later stages, testing is primarily used by identifying the antibodies that is produced from the body from the response to the disease. So you will need ELISA or PRNT in order to identify the antibodies of yellow fever. The evolutionary origins of yellow fever most likely lies in the eastern or central parts of Africa until it would eventually spread onto the other parts of Africa. Yellow fever would then be a endemic virus with outbreaks occurring throughout history, and then it would eventually spread out through the slave trade during the Columbian exchange, as slaves alongside the mosquitoes are then brought over to the New World, where outbreaks would often occur in port cities of the New World and the Old World within the 15th to the 19th century, with first definite outbreak of yellow fever in the New World being in 1647 on the island of Barbados, and in North America there will be an outbreak of the virus in 1699 in Philadelphia, and New Orleans would have numerous endemics with the virus during the 19th century. So yellow fever would terrorize sailors, which would then give it the name of Yellow Jack, as ships that are infected with yellow fever would then hang a quarantine flag that is yellow, and Jack is commonly a name for flags that are hanged up for signals to signal other flags about important information. And until 1881, then a Cuban Spanish doctor named Carlos Finlay would then propose that yellow fever might be transmitted by mosquitoes, rather than previous theories related to yellow fever about it being transmitted through vectors such as bodily fluids or inanimate objects but those would, of course, not work out until Finlay proposed that it was mosquitoes that spread the virus. Unfortunately, his theory wouldn't be advanced or reinforced until the 20th century, with Walter Reed reinforcing the theory by having a control program in Cuba about yellow fever. Then having a control program in yellow fever and successfully eradicating yellow fever from Cuba, to which then the U.S. government would then apply this to the Panama, and leading to the construction of the Panama Canal. So now yellow fever today is still primarily concerned in Africa and South America, with 90% of infections occurring in Africa, and the World Health Organization reporting 200,000 cases per year. So this map is just to give you an idea about where the virus normally lie, as, like I said before, 90% of infections would occur in Africa, with 34 countries within Africa still having an endemic or containing a region with an endemic of yellow fever, while in South America it would have 13 countries that will have an endemic of concerning over yellow fever. So these are the areas within South America and in Africa that would normally be high risk for yellow fever, and this map is provided by the CDC in order to provide information to travelers about which region would be recommended to get a vaccine for yellow fever for. So unfortunately, there is no specific treatment for yellow fever, as with it being a virus, you would have to let it run its course through the body, and hopefully the immune system would be strong enough to overcome the virus. So, but good supportive treatments for the symptoms such as the dehydration, fever, and infection would improve the survival rate. So normally you need to rest up, drink fluids, and take over-the-counter pain relievers for the symptoms. But you need to be very careful about the pain relievers, as it is best to avoid aspirin and other non-steroidal inflammatory drugs such as ibuprofen, with Advil and Tylenol, because those could increase the risk of inguinal bleeding due to their anticoagulant effects. Due to the high risk of severe symptoms of jaundice, organ failure, and a GI tract bleeding, it is very important to prevent yourself from getting yellow fever by getting the vaccine that is just a single dose that will provide lifelong immunity, and as well as mosquito control, to where you just make sure that you don't get bitten by mosquitoes, as mosquitoes are pretty much the only known vector that would transmit the yellow fever virus to people. So make sure to always spray insect repellent in the areas where you would believe there will be a large population of mosquitoes. And on that note, I want to say thank you for watching, and hopefully you learned a lot more about yellow fever from this presentation than you previously know.